Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
Vaccinate yourself, now we go. If you from the VI and you want to get vaccinated, put your hands up high. The life you save might be old. If you from the VI and you don't get vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together, so we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, let we go.
Afternoon, Virgin Islanders at home and abroad, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of August 2nd, 2021. Joining me this afternoon on behalf of Commissioner Justa Encarnacion of Health is Dr. Esther Ellis. She will provide you with the latest on our COVID-19 and vaccine statistics and information on where you can get a free COVID-19 test or vaccination this week. Also joining us today to announce the winners of the July 23rd Vax to Win drawing is Director of the Virgin Islands Lottery Office, Mr. Raymond Williams. But before we go to Dr. Ellis, I need to have a frank conversation with our residents about the severity of what we are currently confronting in our fight against COVID-19. When we began our response in March 2020, we did not know what to expect. We did not know who to look to as an example of what had worked before and what not to do. But we soon recognized that there was no way to realistically stop the spread of this virus that has managed to find its way into every single country on the planet. Instead, we chose to focus our efforts on flattening the curve, making sure to not overwhelm our healthcare system and ultimately protecting the Virgin Islands and Virgin Islanders from losing their lives as a result of this deadly virus. That practical and realistic approach to keeping Virgin Islanders safe has guided everything that we have done, every single decision we have made over the last year and a half. My greatest concern during this time has been having our already fragile healthcare system overwhelmed by the response to the COVID virus. Today, our worst fears are materializing. We currently have 29 individuals hospitalized in the territory, and 23 of those individuals are hospitalized at JFL in St. Croix and 6 on the Roy Lester Schneider Medical Center. I just want you to repeat that for you, that 23 on the island of St. Croix and 6 of those at Roy Lester Schneider in St. Thomas. And of those 23 at JFL, 5 of those are currently on ventilators, meaning that they need a machine to breathe for them, because they unfortunately cannot do so on their own as a result of this virus. We have now lost 39 Virgin Islanders to this pandemic, 9 of them in just the last month, and 2, sadly enough, this weekend. We continue to extend our sincere condolences to the families of those that lost their loved ones and pray for a safe recovery for each one of those Virgin Islanders that are hospitalized at this very moment. You know, I see the jokes and the internet memes, and I hear all the debates. And while most are very entertaining, the sobering reality is that this is a serious situation, dire even, as our healthcare system has ever faced. We are at a serious turning point, Virgin Islanders. And this debate about whether to take the vaccine is not worth your health and it's not worth your safety. While there is a lot of emphasis on the incidence of breakthrough infections of vaccinated people becoming infected, the science still makes it very, very clear. Once you take that vaccine, you reduce your risk of becoming infected with COVID-19 by almost 60 to 90%, depending on what vaccine you have. And if by chance you're infected while fully vaccinated, you are less likely to become severely ill or need to even be in the hospital. Because you are less likely to suffer severe illness or require hospitalization, your chance at survival is substantially greater than that of unvaccinated individuals. You know, while the debate continues, all the evidence and the data points all to the fact that being fully vaccinated is the best defense against COVID-19. Yet, unfortunately, among all the individuals currently hospitalized in our hospitals, and those who have unfortunately lost their life, 100% of them were unvaccinated. That's a significant fact, that 100% of the people who have succumbed to this illness were not vaccinated. The vaccines just prove time and again that they're highly effective at doing what they are supposed to do, which is preventing severe illness and death. As a good friend told me this weekend, seatbelts don't stop you from dying. They just prevent the high incidence that you will. They lower your chances to be severely injured and keeps you safe in the vehicle instead of being projected. It's the same thing with the vaccine. We put on our seatbelts every day. Put on your seatbelt and get vaccinated. Dr. Ellis?
Good afternoon, and thank you, Governor Albert Bryan Jr. and Commissioner Encarnacion, for the opportunity to speak with you about COVID-19 today. As of August 2nd, 2021, a total of 146,679 tests have been conducted in the territory. Of those, 4,663 individuals have tested positive and 142,016 have tested negative. The 7-day positivity rate is now 4.7%. That number continues to increase and is an indication of the surge in the new positive cases throughout the Virgin Islands. There are currently 255 active cases in the territory, 156 on St. Thomas, 95 on St. Croix, and 4 on St. John. 4,369 cases have recovered, and unfortunately, there have been 39 fatalities. Over the weekend, there were 2 additional deaths related to COVID-19, a 68-year-old man on St. Thomas and an 84-year-old female on St. Croix. There is a record high total of 29 hospitalizations, and this is very serious, the highest number of hospitalizations we've had since the start of COVID. The Governor Juan F. Louis Hospital reports 23 COVID-19 admissions with 3 patients ventilated, and the Royal Leicester Schneider Hospital reports 6 COVID-19 admissions with 2 patients ventilated. All hospitalizations and deaths are among those that are not fully vaccinated. It is tragic that we continue to see deaths related to COVID-19 when there is a vaccine available to everyone 12 and up in the Virgin Islands. Our hospitals have been administering monoclonal antibody treatments, or MABs. We've done a total of 296 MAB infusions at the Royal Leicester Schneider Hospital, actually Schneider Regional Medical Center, because that includes the Myra Keating Smith Community Health Center on St. John. 146 have been administered in July. 61 total monoclonal antibody infusions have been administered at the Juan F. Louis Hospital, with 33 in July. The vaccine has proven to save lives, and we need to be proactive in using that tool before people become ill. Anyone who is unvaccinated is more at risk of getting sick with COVID-19 and undermines our chance of achieving community immunity. So far, our vaccine numbers show that 47,350 people have had at least 1 dose of the vaccine, which means about 53.6% of our eligible population that can be vaccinated has 1 dose. 37,281 individuals are fully vaccinated, or about 44.7% of our eligible population. Anyone 12 and older can get the vaccine by walking into any of our community vaccination centers, by calling 777-8227 if you want to schedule an appointment. You can also schedule one online at covid19usvi.com/vaccines. The department's EPI hotline remains open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19. And those numbers are 340-712-6299 or 340-776-1519. We're also offering free vaccines at all of our pop-up testing sites weekly. You can pre-register for the pop-up testing as well online at covid19usvi.com/testing. Our upcoming events are posted on the screen for you now to view. Note that our St. Thomas pop-up times have moved to noon to 2 p.m. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page or our website at www.covid19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. In conclusion, I would like to say a big congratulations to the lottery winners, who each won $100,000. You chose to take the vaccine, and by doing so are not only protecting yourself from severe disease and hospitalization, but also protecting those around you. Thank you.
Thank you, Dr. Ellis. As with everything that we have done over the last year and a half, we will continue to follow the science and that data. And we will continue to enforce our existing rules and regulations that have proven effective in keeping our community safe. I also want to remind you that if you test positive, you are supposed to remain at home and quarantine in a room away from your family and everybody else. We have been getting some really disturbing reports of infected people roaming the streets. And we are taking measures to identify people who are breaking the quarantine protocols. Please stop this. It's a disservice to yourself and to your community. We will catch you, and you will be prosecuted. Just as a reminder, we still have social distancing rules in effect that mandates each person remain 6 feet apart when mask wearing is not possible. We still have a mandatory mask mandate that has been in effect and continues to be, vaccinated or not. This mandate applies to everyone 2 years and older, whether vaccinated or unvaccinated. The one thing that I've gotten a lot of calls this weekend about what we changed and what has changed, we haven't changed much since the beginning of this, further than letting the beaches be open totally, and maybe some other little restrictions here and there in terms of capacity. But folks, we still have a limit on mass gatherings of more than 100 persons in a single space. And we still have restrictions against group gathering, picnic parties, camping, and DJ equipments or bands at the beaches. We still have restrictions on cooking, grilling, and barbecuing at the beaches as well. We have not changed any of these things. What we haven't done is enforce them, because we were doing really well as a community and we were able to control the spread of this virus. The Delta virus is a new proposition. So we still have a restriction on the operation of nightclubs and have not changed our initial rule to allow for operation with seated service only. We never opened up any nightclubs. We told the nightclubs they could operate as bar if they have seated service. We still have a restriction on the sale of alcohol past 11 p.m. and a requirement for every bar and restaurants and establishments to close at 12 a.m. There is still a requirement for patrons seated at the bar in a bar or restaurant establishment to be at least 4 feet apart, and that those patrons wear their masks when not seated, eating, or drinking. So if you get up, you got to wear your mask. Bar and restaurant establishments are still limited to 75% of their seating capacity or 100 customers, whichever is less. Entertainment, in-house music is allowed. Live music is allowed in licensed establishments with social distancing requirements. Disc jockeys, DJs, entertainment is allowed in the same licensed establishment, but must stop at 12 a.m., midnight. That's closing time. Pool tables and games are allowed, but you have to have your mask on. There is absolutely no dancing allowed by anyone, not patrons, not staff. We haven't changed anything. We just eased up on the restriction. But this weekend we came out in full force, and we continue to do so as long as we're dealing with this virus. So bear with us. We want to keep your businesses open. We want to see you be able to go out and have fun with your friends. But we must have strict enforcement of the law, as we move forward. And the executive order, I know y'all like to put on it, by order of the governor. That's fine. By order of the governor, please comply with all the rules, and we can get out of this current surge that we're going on. Now, on the positive side, as we continue our Vax to Win initiative, we have with us this afternoon Raymond William to announce the winners of the July 23rd drawing. He is the Executive Director of the Lottery Office. Mr. Williams, take it away.
Hey, Governor. How are you doing today?
Fantastic.
Wonderful, wonderful. It's my pleasure to announce week 3 Vax to Win special drawing from the Cinque Ward District. The gentleman's name is Mr. Raj Kumar. I'm from the St. Thomas District. Her name is Alana Estrell. I want to congratulate both of them, because this, it's a great thing to see that we're getting people vaccinated and participating. Every single day, I'm getting a text message saying, when am I going to win? I says, are you vaccinated to win?
Are you vaccinated?
So thank you.
That's it. Thank you, Director Williams. And that's the thing, I want to congratulate Siraj Rajkumar on St. Croix and Lana Estrell in St. Thomas, St. John, both of whom are fully vaccinated and will be collecting the $100,000 prize. Thank you for taking your best shot and for protecting yourselves and our community. The name of the next 2 winners have already been drawn, and we're in the process of confirming their residency and other eligibility requirements. Their names will be announced at next Monday's press briefing. For those of you out there who are not yet vaccinated, there is still time to go out and get vaccinated. Don't forget about the special drawings for our school-based personnel, which is open to all our teachers, the faculty, everybody, bus drivers, in whether you're public or private school as well. That's open to you. There'll be 3 winners per district for that. First place, $25,000. Second place, $10,000. And third place, who will take home $5,000. We have more than 1,000 school-based personnel that have already signed up. They're good to go. Make sure you are too. If you're eligible please sign up. If you're not eligible, go out and get your vaccine so you can sign up. You have just a couple of days before the August 9th drawing. And I just want to stress that I love the lottery giveaway. I mean, everybody likes to give away money, but $100,000 changes lives. Vaccines save lives, and $100,000 changes lives. So I hope that those people are putting that money to good use, and hopefully they're putting it right back in our territory, into our businesses, operations right here. In closing this afternoon, I first want to say that I am deeply concerned with where we are in the territory regarding COVID. Deeply concerned. We have continuously been right in our decision making. Through the last year and a half, time after time again, we've chose right. And once again, I'm asking the public to just have a little faith in the team that got you this far, the men and women of the Virgin Islands, your friends and neighbors and family that have been helping us get through this. But if you've been paying attention and following the Brian Roach administration over the last 2.5 years, that I have had the pleasure of being your governor, one thing that is clear is that this administration, we believe in civil liberties, the right of choice and to choose. It is the Brian Roach administration that has created an atmosphere where people feel free to air their opinion, even if it is in opposition to our policies, without the fear of being fired, chastised, or having their contract cut off or their relative victimized. It's the same administration that has rebuked calls for curfews in times of hurricanes and even the pandemic. I believe that we as Virgin Islanders should be able to enjoy all the freedoms that every other American enjoys. But having said that, I must also face the grave truth that as a leader, I have to make decisions that are for the betterment of our entire community over those individual civil rights. The president and many other governors in this nation are now making it mandatory to have a COVID vaccine or presented negative COVID tests weekly in order to be allowed to go into work. This is not really new. There's nothing new under the sun. The fact is that vaccines have been required for decades for many activities, including school and college registration, and even for traveling to other countries. The time is coming when we are going to have to make such a decision if we do not get the cooperation of the public. The time is coming globally when all leaders will have to make similar decisions because this COVID situation is not getting better, it's getting worse. Not taking the vaccine allows the virus to mutate and figure out ways to overcome the vaccines that we currently have in the market. We live in a community, and more, it's not about your safety alone, but the safety of those you live, work, and commune with. We can get there together with your cooperation, without drawing a line in the sand between the vaccinated and the unvaccinated. Let's work on it. Get yours and take someone to take theirs. We have a lot of good things coming down the pipe for our territory and our people, and I want each and every one of you to be alive to enjoy them. Let's get there together. Thank you, and I'll take some questions from the press now. Lasiba.
Hey, good afternoon. How are we doing today?
I am well.
Awesome. Lasiba Knight with the St. Gravis. So I just have three quick questions. You kind of gave me the perfect lead off into the first one. You referenced seatbelts and likened them to the vaccine in that they reduce your chance of death when used correctly. Seatbelts have been for years mandated by the government.
Right.
To drive a car, to be a passenger in a car, you have to wear a seatbelt. Are you considering such a similar mandate with the vaccine? I know you said you don't want to draw a line in the sand between the two groups, but at the same time, it seems as though there's maybe some foreshadowing there. A decision must be made, so I'm wondering.
Well, absolutely, I'm considering this. You know, the unfortunate thing is that you have to protect people from themselves. If you figure 9 people died this month, you do the math, 9 12s is 108 people in the next year, and already the CDC is predicting that they're going to have more virulent variants come out, things that are more infectious, that are more deadly, that's related to COVID-19. I have to think about the greater good, so absolutely I'm considering that as a measure to get us to 70-80% where we can get herd immunity. And I keep stressing, you know, the problem ain't getting COVID-19. The problem is dying from COVID-19. As long as we have hospital space to take care of you, and you're going to be okay for the most part. And if you're vaccinated, even better yet, you're not going to have to go to the hospital. This thing one day, one fine day, will be like catching a cold. But for right now, we have the greater community to be concerned with.
And then, Dr. Ellis, when you were making your remarks about hospitalizations and deaths, you said fully vaccinated. And so I'm wondering if maybe there was a case, a hospitalization, or a death that happened to someone who was partially vaccinated with maybe one shot of the Moderna or the Pfizer.
Yeah, so far all of the 39 deaths in the territory have not had a single dose of the vaccine. Fully vaccinated is 2 weeks after the second dose. We have had someone a day after they got their first dose had COVID symptoms, so they probably got exposed before they got the vaccine. That person did recover. So that was a not fully vaccinated, but they had recently gotten their vaccine.
And just to be clear, there's no hospitalizations that you're aware of where it would have been a not fully vaccinated person, right?
Can you repeat your question?
That there's no hospitalizations, because you mentioned someone who was ill, but I'm just concerned about hospitalizations.
There was one hospitalization in someone that wasn't fully vaccinated. They had recently received one dose of the vaccine. That person did recover.
Thank you. Mm-hmm. And then, Governor, about your recent enforcement action, you mentioned that the task force went out heavy. I was wondering if how many citations may have been issued, or if you have a number on businesses that were closed down over the weekend.
Yeah, I think we focused more on closing them down. We closed down even grocery stores because we realized that the spread among employees is really bad as well, too. People are not wearing their masks when they're at work. I could get that information from you from
Is that what happened to Costulas on St. Thomas?
No comment.
All right. Thank you very much.
Thank you, Lasiba. Diana Diaz, The Source.
Good afternoon, Governor. This is Diana Diaz with the VI Source.
Good afternoon.
Back to potentially making vaccines mandatory. What are some of the strategies that you will possibly implement to ensure getting vaccinated becomes mandatory?
Yeah, if we were to move in that direction, I would issue a executive order saying that every single government employee or any hiree must be vaccinated before they enter into work, or prevent a COVID test weekly. That would be the way we would go, so you would still have a choice, but you would have to get that COVID test weekly. And then we would just, there are 9,000 government employees. We think that is about the furthest we could go. We couldn't go further than that in terms of mandating that everybody who's going to work. But I'm receiving a lot of calls from private businesses that are also asking me, how can they enforce this mandate at their work? Because they are losing a lot of money, employee time, as well as personnel. People are dying to this thing. So one of the big things that I struggle with on the other side is if we're knowingly letting people who are not vaccinated into our government offices, we're putting them in jeopardy. We're putting them in jeopardy of contracting the disease and dying. And knowing that we have a way to protect people from this is actually very negligent. So we know that if you're vaccinated, you probably will survive. And now you're in a situation where even a vaccinated person can become virulent to the point where they get enough COVID in their system that they could transmit it. You're putting the unvaccinated people in jeopardy of contracting the virus and dying. I'm amazed at how many people live in and around. I mean, they're all over our community. People with compromised immune system, people with comorbidities. That's what, when they say comorbidities, that's like people with high blood pressure, heart disease, people who have hypertension, people who have diabetes, and a host of other things that our friends and neighbors have. I mean, if they get it, they're in serious trouble. So first of all, those people need to get vaccinated, but if you live in the house with them, you need to do so as well.
Thank you. You mentioned the law enforcement community, and you gave us examples of what their day looks like. Are they ready to handle the situation if the surge gets even worse?
I expect the hospital to issue a statement, but it is in St. Thomas where we have 4 times the tourists coming in as in St. Croix. We have 23 people in the hospital in St. Croix and 6 people in St. Thomas, where you would expect to see the higher numbers. The 23 in St. Croix is an aberration because unfortunately there was cross-contamination at the hospital where patients went to the hospital COVID-free and ended up with COVID. There we're doing right now some mitigation efforts to be able to separate out patients and make sure that we control anything that is going on. The hospital should be issuing a press release on that coming out, but this is the reason why we have this. And I'm not blaming the hospital at all, because this is what happens when our healthcare workers get tired. More and more people come to the hospital. I think we had 4 gunshot wounds this weekend. Our St. Croix Hospital is at capacity. St. Thomas Hospital has a census today of 67. That's pretty much at capacity. So we're doing some things now in connection as a team between health, St. Thomas, JFL, as well as Roy Lester Schneider. We're working together to do things like see if we can move patients to the high infectious disease unit in St. Thomas, trying to see how we control the flow at the hospital. So don't go to the hospital to visit. We're on tight lockdown right now, and making sure that we take care of those patients and make sure they get out. Okay, so we have a little tight window. By Friday, we're going to get some more personnel in on both islands to help with the hospitals. But the only good news or the light at the end of the tunnel I see that is in St. Thomas, we have a low hospital count. But I just want to say, thank you to all my healthcare workers, because I know it's not easy. I mean, this is going on and for a year and a half, and they're very tired. Our police officers, our enforcement officers, they're tired too. And when you get tired, you end up making mistakes, and people let things slip through. So we're getting some support for you out there. I know we got you. Any more questions, Diana?
Yes, with the sudden surge of government office closures, do we have a specific reasoning as to why so many are happening? Is it COVID related? And also, what is the protocol when they do? And is it a cost to the government having to shut down these offices?
Absolutely, absolutely, and absolutely. 90% of the shutdowns we're having is because somebody in the office got COVID and was diagnosed. So when that happens, then we got to shut it down, clean it. Yes, it's a cost to that. We pay for that. But that's the least of the expense. We lose weeks of manpower. Sometimes we can get employees to go home and do the work, but a lot of times they need to be in the office to deal with the systems. So the easy solution to that is get vaccinated. When people are vaccinated, they're least likely to contract the virus in the first place and then to spread it. So we're just dealing with it as we go. Our private sector is dealing with it too. I know of a couple places that had to shut down all their offices, various types of businesses, and get them sprayed out. The thing with the private sector, though, FEMA covers ours, and the federal funds, they're not covered for those types of cleaning as well. So we're going to be looking into how we can help businesses deal with this through this rough time, as well as employees who can't go to work, because some people don't get paid when they go to work, even if it's a COVID shutdown. So lots of hardship in the community that comes about with dealing with this virus.
Okay, one last question pertaining to students being fully equipped for the school year. In terms of laptop distributions and internet access, in that sort of thing, are we ready?
Yeah, we're ready. I mean, that's an old drill. We collected most of them last year when we ended school. We're going to go through the redistribution again of giving them back to the students. And then, of course, we have new students coming in. They'll get a new laptop. So, yeah, we're good to go with that. With them not coming into school, it's going to present a little bit of a problem, but we're going to work around it.
Okay, thank you.
Thank you, Diana. Ernest?
Hey, Gov. Good afternoon. A few questions there. Two quick follow-ups. So the situation with the consideration of a mandate for government employees. So again, obviously, you said you could go as far as government employees with the option of testing every week if they choose not to vaccinate. That's correct? Just a clarification.
That is correct.
Okay, and a follow up on the JFL. So I had a question about it. We got two calls relative to persons who had their relatives in there, including a 90 something year old who came to the hospital COVID free, left, and then contracted the disease. But according to this relative, this is the person's parent. They released this person with COVID, and they got a call on the phone stating that this person only has a few more days or so to live. I'm mentioning this to speak of the serious situation at GFL. As you rightly mentioned, you have 6 folks at the hospital at Schneider and 23 on St. Croix. What is the mitigation effort there, and what caused that? What is being put in place to prevent such a situation. The hospital sent out a press release, but it has nothing on there. They just spoke of what they're going to do, but there was no indication that something like that had occurred. And like you rightly mentioned, that should have been made public. So, what is happening there to mitigate such an issue?
Well, as I mentioned, right now we're looking at space and segregating patients. We've brought in some extra bedding so we could separate the COVID patients from the regular patients. We're still assessing to see if we're going to need to transfer anybody over to Roy Lester Snyder in St. Thomas, even though that hospital is under some stress as well too. And I misunderstood you when you said they discharged the patient, but then
Yeah, I got a call from the child, an adult of 190-something-year-old who was admitted to the hospital COVID free. So apparently this person was not at the hospital for COVID,
right,
uh, and then they re- basically they told them they got to go home, and that person came home with COVID, and then this is from the child, an adult of the person,
right,
called early this morning, yesterday morning, very, very distraught, and
right.
stating that they got a call on the phone, and the call was, we're giving this person, the 90-something-year-old, a few more days to live. This person called us crying. And so I wanted to ask you about that situation, and what really is going on over there, and what type of help, how strained is the situation at JFL?
Yeah, I'm aware of the situation. I made some calls on that last night to try to get some home care for the patient. If it's the same thing,
Okay.
the justification of the hospital was the patient did not need to be hospitalized because they had COVID. They didn't have that COVID situation where they had to be hospitalized. They just happened to have COVID. As to the time that the individual has to live, I didn't hear anything in that regards, referring to how much time the person had left. So I tried to call around last night. I think we got the situation controlled with some home care because it is a dire situation that we're dealing with. But at the hospital, we're doing all our best to try to control the spread that we have right now. And Commissioner Encarnacion, I hear in my head like all the time, all at night. I hear her telling me now, this Delta variant. It's not like it's not like the other variants. It's like 4 times as transmissible. So the things that we were doing before and could get away with, we can't get away with it anymore. So if you're talking in the same room with somebody who has this, you're going to get it. And then our healthcare workers, we use them in multifold ways. They work in different institutions. Some work in private hospitals, private doctorships, and hospitals as well. Some work at the senior homes. Some work private care. They could have gotten COVID anywhere, but somehow it was transmitted to other patients. So we're trying our best now to control that situation. But one thing that I always say in all this, right? Nobody's vaccinated. If
Right.
you got to get vaccinated. I mean, I don't know how to say it, Ms. Ande. It's just like this is a choice. This is your personal choice, yes. But when you get sick, you become everybody's responsibility. And if they say, when in a crisis, put on your life jacket first. The plane crashing, we need to get your life jacket on first.
Yes, Gov, a quick follow-up on that and to some other questions. So the services we're using to supplement staff at GFL, is it Pafford? Where are we
Yes.
getting the extra employees? Okay,
Pafford is our most immediate resource to get people, but remember, every single hospital in the United States is going through that. Well, I shouldn't say every single one, but most of them are. And we're not only looking at Pafford, we're looking at other places, and yes, I know it's expensive, but dying is worse. So whatever it is I have to spend to protect people from themselves, that's what I'm going to do. So yes, Pafford and anybody else who's out there listening to me now, if you have respiratory therapists, nurses, doctors, please contact our Department of Health or our hospitals. We need the help.
all right, Gov, and let me go to something else quickly. I don't think we've ever gotten this number. It's kind of been ominous. And so talking about the breakdown between vaccination percentages per district, right? So residents could get a clearer understanding of what is going on and where needs the bigger push in relation to vaccination efforts. So, or drives. What is that breakdown? So St. Croix, what is the percentage on St. Croix, and what is it on St. Thomas to make up the whole of altogether 53 something percent that we got?
I'll defer to Dr. Ellis on that. She has more statistics.
Yeah, Ernest, I don't have that breakdown right in front of me, but I can definitely send it to you today.
I think the
Okay.
vaccination rate is slightly higher in St. Thomas, though.
Yeah.
And
St. John's the highest.
yeah. So and then you got to factor in, like we figured, is 6% tourists. So you figure 43,000 people vaccinated. 2,000 are probably tourists. You figure St. Thomas probably have 1,500. So their vaccination rate is a little higher, but you got to take out like about 1,000 or so tourists out of that.
Okay, thanks. I look forward to that info. Two more questions, but this one is relative to the Polaris Key situation. There is Commissioner Encarnacion with us?
She's not here, but you could ask a question. We'll try our best
Okay,
to answer it.
okay, thanks, Gov. And so the Polaris Key, one employee, a consortium employee, was traveling back home, and we're trying to get the situation through. So you insert your vaccination details, and then you get through. But part of the reason that we were told by officials that it wasn't going through is that you must sign up through the Polaris Key program
Right.
in order to get that. So I had a few concerns about that, right? So why is it mandatory that one must sign up through Polaris Key before getting confirmed to come to the territory once they're vaccinated? Again, I wanted to understand that, and also please explain the program more. So why, I know the commissioner spoke about, some of the information with Polaris Key would be, shared with other local entities. Do we have a breakdown of who those local entities are? How safe, is that information being kept? I wanted to understand that because it's a bit concerning that you must sign up to Polaris Key. Why can't one just put in that information, get the green QR code, and pass through?
Okay, Ernest, I can answer your question. So actually, you don't have to sign up for the electronic vaccine record to be able to travel back into the territory with your vaccine status. The way it's designed is actually to protect people's health information as much as possible. As you're filling out the portal, there's a question that says, were you vaccinated within the U.S. Virgin Islands? If you click yes, then the portal checks Department of Health's database to see if we have a record of your vaccination. And if we do, regardless of whether you wanted to get the electronic record or not, you'll get a green code. In some instances, data might be incomplete, and that's dependent upon where you got vaccinated. Each provider had to put that data into a database. It's called VAMS. And so that might, for an example, maybe the provider didn't put in the second dose. If that happens, then an email gets sent to our epi@doh.vi.gov, and we validate with the provider, yes, indeed, this person did get their second dose on X date of Pfizer, whatever it is, and then we fix the database and the person's cleared to travel in. So there are instances where a person's record might not be 100% accurate, and we're updating the database as those come to us. The second component is the Polaris electronic vaccine record, and there's different entities that want to be able to quickly check someone's vaccination status without having access to any other health information as far as what vaccine they got, date of birth, or any identifying information beyond, yes, this person was vaccinated. For example, JFL is one of our partners, so if they want to check to see if someone's vaccinated, they can through the electronic vaccine record. It's the most secure record and way to share your vaccine information electronically, and as well as it's a secure record in that the paper card that everybody got when they were vaccinated is not a secure record.
Okay, and so is the Polaris Key a government program or is it an outside entity? Who owns the Polaris Key? I was trying to do some research on the net. I couldn't find anything.
It's a,
Does the government?
it's a Department of Health initiative. EPI started the project, and we own the data.
Okay, excellent.
The software is
Thanks for.
public though, right? I mean, the software, anybody could buy a Polaris Key software, but the data belongs to the Department of Health.
Excellent. Thank you for that. Governor, last question there, and it's a lighter question, but nonetheless, concerning the vaccination situation there. Isn't $100,000 a bit much? You know, we've gotten that from a lot of people. Folks were giving other suggestions. You know, probably give folks $1,000, right? So 500 for your first shot, 500 for your second shot. You'd probably have folks lining up every center to get vaccinated, as compared to 100 grand, where folks feel like it's exactly that, a lottery, right? And I'm not going to win, so I'm not going to play. I'm sure you heard President Biden is even trying to offer $100, right? But how about a different strategy where it is lower, but it is spread more broadly?
My thing is always, philosophically, I don't think that we should reward the people to take the vaccine and the people who took it already don't get anything. So I have any problem with giving people, if we could give everybody, but 43,000 times 1,000 is 43 million. We don't have 43 million to put on vaccine, and then we would have to we get it to like 50 or 60,000, so it'd be like $60 million. Right now, we're doing this promotion and see how it works. But to be frank with you, the carrot is always feeding people. We try and be positive and encourage people to do the right thing. It's getting time where it's like we got to continue to function as a territory, and we're just going to have to. It's going to be difficult for the people who don't want to take a vaccine. Your life is going to be more difficult, and I don't want that. I don't want it to be where we say, restaurants, if you can show your Polaris Key vaccine record, then you can go in. If not, you can't. Church, any place like that, we don't want to do that. We want people to cooperate.
Okay, Gov, thank you so much.
Thank you, Ernest. That's it, folks. We got another question? Unidentified good person, go ahead. Hello? You lost him? Go ahead. It looks like we lost him. Anyway, once again, please stay safe, stay sanitized, get vaccinated. Love you and be safe out there.